For patients with prostate cancer, surgery or radiation is more than appropriate. Sometimes it can be life-saving, yet some patients have a lower risk, making them eligible for active surveillance. The key question for all patients is, what is my risk of dying from prostate cancer? A genetic test could provide that answer. Al Piazza had it done. He's living with prostate cancer. Also with us, physician and board-certified urologist, Dr. Jeremy Lieb. Good morning, gentlemen.
Good morning to you.
Thanks for having us.
Hey, Al, how are you feeling?
I am feeling wonderful, thank you.
Well, we're glad to hear
this
that.
This was quite an experience for me, Mary. When I was first diagnosed with prostate cancer, the 4 words that nobody ever wants to hear is, "You got prostate cancer." Literally took me to my knees. I was devastated. 70 years old, finally retired for the last time. Looking forward to my retirement with my wife, my 10 grandkids. Wanted to do all these things in my future, and everything came to a screeching halt because of this prostate cancer. Not knowing what to do, I panicked. All I wanted to do was get it out of my body, have it removed, get rid of it. I don't want to have anything to do with this. When I went to Dr. Lieb, who diagnosed my prostate cancer, thank God, he says to me that there's an alternative to this besides this radical cancer treatment. He goes, why don't we take a look at a test called Prolaris? And that's where he came in and saved my day, believe me. The Prolaris test actually told me what the chance of my mortality was in a 10-year time frame, and mine was a 3% chance, and it just made all the difference in the world on my life.
So he was clearly a candidate, Dr. Lieb, but who else is a good candidate for this test? What do you look for?
Yeah, prostate cancer is very common. 1 in 7 men in America are diagnosed with prostate cancer. So any man that has been diagnosed with prostate cancer is a candidate for genetic testing. The Prolaris test looks at the cells to determine how aggressive they might be. Surprisingly, many men who have prostate cancer may actually not need surgery or radiation. They might be safe just to watch the disease. We call it active surveillance, where we're monitoring their prostate PSA blood test, we're monitoring their exams and additional tests. So some men can live 15, 20 years without any treatment at all.
You just mentioned the PSA. How is this genetic test different than a PSA test?
The PSA is a blood test that's ordered by many primary care doctors. It's part of your annual routine test usually. So if the PSA blood test is a little bit elevated, that usually will lead to a referral to a urologist. And that urologist may end up doing biopsies on your prostate, and that's when we can find prostate cancer, is by doing the biopsies. When we do the biopsies in the prostate, we see the cancer. A lot of times we might think it's aggressive. It's all depending on what the cancer cells look like. But a test that's a genetic test like Prolaris, it actually looks into the cancer cells and helps you understand on a different level how aggressive the cancer might be.
Al, what did you do with the information? You said you got your results back and it changed your outlook on that diagnosis. What ultimately did you decide to do with treatment?
Well, you know, after I did some research on it, which was very important, I needed to know what was going on. What was this cancer that I was having in my prostate? So I educated myself. I talked to my doctor. I trust him very much for what he's done for me. So the help of getting this information and knowing what to expect going down the road was just a life changer. So at least with a little education, you know what to do. Take care of your body. It's a man's body. We're so afraid of this that if we don't know anything about it, you can't do anything with it. So you need to educate yourself, especially on what's going on.
Give us one website so that our viewers, if they want to learn more online, they can.
Yeah, the website is www.prolaris.com. That's Prolaris.com.
Gentlemen, Al, Dr. Lieb, thank you for joining us. We appreciate it.
Thank you very much.
Thank you so much.
Thank you, and all the best.